KCUT is a group of young individuals coming from different professions and different backgrounds who joined us at the Digital Health Rights Project implementing team in Kenya, and they joined us to bring about a perspective of youth involvement in the Digital Health Rights Project, which is coming forward from the aspect of meaningful participation and ethical involvement of the youth while we do a project involving the youth in Kenya.
When I saw the application process, the vacancy process, I knew this was the space for me to advocate for the policies and the change, and the change that I want to see among the people living with HIV and as a person living with HIV, because we tend to, policies tend to come and they're told, they'll fit people living with HIV without their voices. I knew the KCUT process, will give me that voice and the voice of the people, of the community of people living with HIV.
So being part of this team gives me an opportunity to ensure that, to advocate for inclusion of our marginalized community, our communities in the remote areas, so that they're able to access health services and information in a safe space where their security and data privacy is well taken care of.
My main motivation to join the advisory team is so that I can be able to use my skills, my expertise to influence conversations and be able to also touch on policies related on digital health, but also with a key focus on young people.
It was important for us to recruit the KCUT members who come from diverse backgrounds and also have that youthful lived experiences to be able to achieve a meaningful participatory action approach even as we conduct the Digital Health Rights Project. It's important for us to have the voices of the young people within this project that involves the young people.
Because when you look at participatory action research, first of all, there's the part where we are all meaningfully engaged in all processes in the research, but also number two, that we are taking action based on the research that has been done, so that we are utilizing those findings to impact change and influence the things that we are supposed to do around digital health and rights.
So it is crucially important to train young leaders, particularly in the KCUT, so that these young leaders are the voices for the communities they serve, to be the voices of change, to create an impact in the community they are in. We believe when these young leaders are empowered, they're given the skills, the knowledge and exposure, but also the experience we share in our trainings, they'll be able to carry on the legacy, to carry on these skills and empower others, and through a multiplier effect, we shall have a greater impact in the community.
Beyond the project, we are able to look at some of the policies that are being changed and some of the work around advocacy, beyond advocacy's changes within the communities.
As a healthcare person, I felt the need to be part of this so that we can promote the ideals that I think are very integral to me, issues of about patient protection and protection of data, which is a key issue in digital health.
For me, this has been very important because I deal with a very sensitive topic in regards to HIV, and we do not want to be in a situation where information about young people who are living with HIV is put out in the online space and it's not protected.
This is a new component or a new approach that I can be able to also educate my community, and now with the data and all the research, then I'm able also to improve my advocacy skills also as a youth leader.
Digital health or new technologies are giving us this opportunity. We don't have to walk door to door. We just need to go to either X or TikTok or other social media and collect data from these young people.
This has been a groundbreaking training for me in terms of understanding myself so that I'm able to lead my community in a more powerful way.
A key component of this training has been a lot of self-reflection, just getting to understand and learn more about our leadership styles, understanding why it is important for us to have, personal goals and being very clear about our vision and what exactly we want to do to transform our communities. So I am living here having a sense of understanding of you know, where I want to go and what exactly my role is when it comes to transforming my community and the young people that I work with on a day-to-day basis.
So it has been able to strengthen my mobilization skills, my leadership skills, and so I'm confident enough whenever I get to spaces. I'm sure that with that experience I'm able to really represent young people, and it's shaping the person I am today in terms of the skills I'm having, the knowledge I'm bringing to the table, but also what I need to learn even as part of my mandate at the advisory team.
In the end, we are looking to influence laws and policies that are going to bring a change in the digital health community, and I feel like it's a very timely project because much as we want to influence these laws and policies, at least we are able to do it from an informed place after we have done the research, and we are able to add meaningful advice. And even on our way to the findings, there are so many beautiful things that we are able to do and engage meaningfully with the youth that is also going to add value even as we do the research itself.